Hola, buenas tardes.
Hello, good afternoon or good morning, depending on where you are. I'm Mesojectgun. I'm Technical Advisor of Toskani. And this afternoon or morning, depending on where you are, we are going to deal with a problem that we find every day in our aesthetical centres or in our medical centres, and something that we are very concerned about. We're going to deal with anti-aging, and we're going to see from Toskani how we can deal with it and how we work with it. So to start off, we're going to do a bit of a revision about the anatomy of the skin. So more than just to remind ourselves of what the anatomy is like, what I'd like to look at is see the different dysfunctions that we have and which appear as we get older, and how this affects us visually, as how our patient or how our customer starts to have their first signs of aging. So we have in the skin, we have the epidermis, where we have cutaneous cells, pigment and proteins. Then we have the dermis layer, where we have blood vessels, nerves, pilus, follicles and sebaceous glands. Then we have the hypodermis, where we have the sudory glands, pilus follicles, blood vessels and fats. So we're now going to have a look at how each layer of the skin is affected. So as I mentioned before, so we have this aging, this cutaneous aging, as we see it ourselves, the first symptoms of it, how they are, and how these are visual, how these look visually on our patient's skin. So in the epidermis, we start to have a slower cellular renovation. We also lose the protective fatty layer over time. And visually, what we see in any patient who comes to see us is skin which is drier, which is rough, and which seems thinner. It doesn't have a lot of thickness. So we can see often that it looks stuck. And we have greater sensitivity to UV light and diminished quantity of melanocytes. And we also, the melanocytes that we do have grow in size. And the first signs that we have of this, and which we can see, are pigmentated stains or senile purpura. Then we have a lower capacity to heal and to oxygenate. So the scarring process of the skin in any tissue is much less and much slower than before we went through aging. So in the epidermis, now let's move on to the dermis layer. So what happens in this layer and how we see it in the exterior and how these signs are pronounced. So we start to have the sebaceous glands producing less acid, less oil. So obviously we have a loss of humidity and the skin looks drier, and the skin can also be itchy. So we also have the first issues with our blood vessels, which can become more fragile. And we see these as little breaks in the blood vessels. And you start to see those, especially in this area of the face. So here you can see them. And what you can see is little lines around the nose. So you can see some senile purpura lines. It's not so much a stain in itself, but it looks more like rosacea. So when I put pressure on it, and where I put pressure on it, it will disappear, but then reappears as soon as I take the pressure off. So that's due to the fragility of the blood vessels. So then we have a reduction in the circulation of the blood. So with this, the first thing that we have is diminished supply of nutrients and of oxygen in our cell, and a decrease in the rosy glow on the skin. So now let's have a look as well at how aging affects the hypodermis. So what happens to our hypodermis level? We continue to have a reduction in blood flow around there as well. So we continue to have the same diminished supply of nutrients and oxygen. We also have the changed skin tone. So here we have a reduction in the number of the cells which store lipids in the adipose layer. So what does this mean? This means that we lose volume and we have deeper wrinkles, and the area around the cheeks, we have sagging skin. So here you have the apple of the cheeks. It's usually quite plump when you're younger, and over time this sags, and you'll see that the fat around this area disperses around the face. And this is due to the adipose layer storing fewer lipids, and then we lose this tone in our faces. So, having seen all of that, what can we do about it? So now we've seen what happens in the different layers of our skin. So we've seen what that looks like on the outside. So how can we deal with this? So first of all, we have in Toskani a 360-degree solution. This is our approach to skincare treatments. And that is made up of 3 phases, as should always be the case. So any treatment which we do must always first have a preparatory phase, the second and third phases as well. So the third phase being the home care the patient does after coming to a consultation, and they must work with the same active ingredients and have this continuity, and that was what will give them results. So we're now going to have a look at the first phase of the preparation of the skin. So for this, we're going to speak about our chemical peelings and our peel boosters for this line that we have in anti-aging. So in this session, we're going to speak about the different products and the different main ingredients, and then they will appear in different protocols that we will look at later on. So what I'd like to be clear about is that you really understand the main ingredient and what it does, where it acts, and what result it's going to offer me. So we're going to work on product by product and per active ingredient. So let's start with the first acid that we have, which is the photoaging peel. This is combined acid, and we call it the photoaging peel. So this photoaging peel has salicylic acid, it has lactic acid, and it also has citric acid. So salicylic acid has a keratolytic action and is also sebum regulating. So we have problems with the loss of humidity in the skin and the loss of lipids and fats. So then we find lactic acid, which has a hydrating and humidifying action. So with these 2 acids, we will maintain the lipid action of the skin. We'll reestablish hydration and nutrition. Citric acid is an extract from citric fruits, which has a strong antioxidant action and anti-free radicals action. And that's going to give a lot of luminosity to the skin. So within the photoaging peel, I have to remember that it contains salicylic acid, lactic acid, and citric acid. So I'll repeat, we will maintain the lipid balance, we will not lose so much water, and also it will provide us a lot of light in our skin and a lot to our tissue. Another acid that we have is the rejuvenating peel. So this is a pyruvic acid, and it boosts the production of fibroblasts and gives new collagen and elastin to the tissue. So what are we going to work with this? So this, we're going to work with this pillar, which makes it so that I don't lose toning to my skin, that it will put up with this aging process. So with this combined acid, we will go back to find lactic acid that we saw before when we were looking at the layers of the skin, the science that we can have in this. So one of this is the loss of water in the skin and the regulation of the lipid balance. So here with the combination, we are working with elastin and collagen, and I continue to treat the hydration. Another acid that we have within the anti-aging range is was a very well-known acid, and this is the one that possibly we might all be aware of the most. This is the glycolic peel, which is derived from sugarcane, and it has a high capacity for breaking tissue union filaments, and it stimulates the deep layers of the epidermis, which is going to allow us to work on acne scars, on light and moderate wrinkles that I may have in my body, or may deal with stretch marks, and will also work on flaccid skins that I may have. So another thing that we're going to point out about this acid is that it's an acid which is photosensitive. So during the summer period, we have to be careful with this, and we would recommend a different acid to work with, as it wouldn't be recommendable to use this and then expose your skin to the sun. So here we have the lactic peel. So this acid, we have looked at it in our combined acids. So it's a gentle acid which brings luminosity and hydration. It slowly penetrates the epidermis and doesn't cause a significant amount of peeling. So that way I can still maintain the water, so I don't lose the water from the skin, I don't get dehydrated. It's all it's convenient and very appropriate for reactive, sensitive or dry skin, and which has tendency to be very red. And often when you have a very fine, very white skin with tendency to wrinkle, especially in this area around the nose and eye area, which is very vascularized, and all the vascularization, what it does is create heat. So it was as though we were in a pan, for example, and it's constantly burning, and what it's doing is losing water in this area and from my blood vessels. So it's very important to be able to reestablish and be able to tolerate, so that my skin doesn't get dehydrated, and combine it with lactic acid. So another acid that we're going to talk about is different in its function, and its function is to illuminate and unify all of the skin tone. So this is the spot out. So now we will talk about who it's aimed at. In principle, we are going to see what treatment is. As you can see here, from the moment we started in the consultation, we have sun exposure until the moment that we finish. We have to explain to the patient what it's for, what it is, and how long it lasts. So the duration of the effects, and the moment that I apply it to the moment that I have the most results, is usually around 6 months. So we have the part of the product, and then we also use this in our consultation, and then we also have the home care, and we use this also in the consultation as well, but patients can also use this at home. So we have the Total Recovery Cream, which is very regenerating. What we do here is, upon request, especially on the first days, to regenerate the skin, to restore it and to plump it out. And then we have the spot out cream, which you can put, depending on the on the time of year, morning, during the day, or at night. So who is spot out mainly aimed at? So spot out acts in the melanocytes where there's an excess of melanin. So what it does is it eliminates or reduces melanin sourced spots which have been acquired while inhibiting the process of melanogenesis. So it paralyzes the production of melanin for a certain period of time. So it's reversible. And during this time, the peeling of the horny layer and it takes away the melanin deposits. So now we've talked about how to prepare our skin and the concept of phase one, and this is the phase which wakes up the skin, of exfoliating it and trying to prepare the tissues. We now move on to the second phase, which is very important for us, which is the mesotherapy with our pulse booster technology. So how are we going to, let's explain this a little bit. So what is it involved in it, what's involved in our cocktails of mesotherapy, in our mesotherapy products? They are sterilized and they are also effective. So they offer efficient and safe solutions to correct skin problems on the face, on the body, which we can have. And we remind you that our products of mesotherapy are always completely free from added preservatives, fragrances, colorants, nanoparticles, phthalates, and ingredients derived from humans. So let's have a look now at evaluating the cocktails that we have and we can use in this line, this anti-aging line. So the first cocktail that we have is, you can see it here, and then later on you'll see it in the protocols. It's a grade 1 cocktail, which is called anti-pollution cocktail. So this treatment is, what it does is prevent skin aging caused by pollution. So very often when somebody comes to our institute, sometimes due to our age or due to the person that we are, we say that it's a grade 3 anti-aging process. We might say that they are correct in the diagnosis, but we need to look a bit further and try to have very solid bases. So we always have to have the skin very well prepared. We saw before that maintaining the lipid layer of we look at the elastin, the collagen, the oxygenation of the cells to make sure that it's prepared to receive all of the main ingredients that we're going to give it. So it's very important to start with the base and by oxygenating. And we find as grade 1, and we can use this in many occasions, we find anti-pollution cocktail, which has 5 growth factors. And what it will do is protect the barrier function of the skin. It will vitalize the cells and prevent oxidative stress. So we also have a grape extract, which works at cellular level on oxidative stress, and this will help my skin to breathe and to oxygenate. And then we also have isomerate saccharide, which works on the synthesis of melanin. Usually the cells start to become colored or stained, they change tone, and they have irregularities. So it's very important to avoid this and to avoid the entrance of nanoparticles in the skin as well. So we will see this very often in our skin, which is in oily color, which have a dull color. So this is a cocktail which works to oxygenate and regulate the layers and to awaken the skin. So we're now going to have a look at another cocktail that we're going to find. It's still in the anti-aging range, and this is a grade 2 anti-aging cocktail. So this is going to provide a tensing action, provide hydration, and improve the appearance of light and moderate wrinkles. So in our main active ingredients, what we're talking about is going to reappear in all of the cocktails and all of the lines that we're going to talk about, and in the home care range as well. So we will start by having hyaluronic acid, where we have hydration of the tissue at the dermis level, and then this will provide hydration that we've been losing. So sodium DNA as well, organic silicum, and DMA, where we will find this light and tensor effect, and to have this camouflage effect that the skin might have and give us toning. So now we're moving on to grade 3 anti-aging. We have the anti-aging cocktail. So when I use anti-aging cocktail on somebody, this is an anti-wrinkle solution with a hydrating, reconstructive and firming action indicated for moderate to severe aging. So here we start by repeating as well the main ingredients, which is hyaluronic acid, and this is going to give us hydration in our tissue and in our skin. And we will also find the acetyl hexapeptide 8, and with an effect which has Botox effect, which will reduce the depth and this wrinkle, and will have this effect which is like Botox. So it looks like the immobilization to not work, allow your muscles to work so much. So you have DMAE, pyruvate, and L-carnitine, which is restorative. So L-carnitine is restorative, and it allows the cells to breathe and regenerate the cellular tissue. So this is a very complete cocktail, which will give a less deep wrinkle, a tensor effect, and which will plump up the skin and maintain the toning. So now we've looked at all of these treatments that we have seen, and we've spoken about the anti-pollution, we've spoken about the Mesolift, and we've spoken about anti-aging. We're now going to see the firming cocktail, which is the last one that I would do in a grade of anti-aging due to its tensor effect, to tense up and to plump up the skin and to give it a tensor effect. I have to, first of all, have the balance of the lipid layer, and I have to have the barrier and the sustaining prepared. If otherwise it's not possible, but by tensing something up, if its bases are not there, so as they ought to be. So the firming cocktail activates the collagen synthesis and elastin, so promoting the skin recovering their firmness and tensor. So for the generation of elastin and collagen. So in its main active ingredients, the main ones are elastin. We will have, again, DMAE with its tensor effect, and we have vitamin C, which acts on the free radicals, and it promotes the cellular oxygenation. So now we're going to have a look at the under eye area. So this is an area which has a much finer density, and we will try to dissimulate all of this wrinkle and flaccidity that we can have in the upper eyelid area. This treatment works with Myotech. So this is a peptide, which is a fragment of SNAP25. We've seen this in the cocktail that we had before. It also has acetyl hexapeptide 8, which is a substrate of botulinum toxin. And So this monodose, we'll see how we work with it and how we can make it more effective to be able to deal with more problems in the eye area. So now let's say how we're going to do this. So to boost the strength, the action strength of with TKN Advanced. So here we have the peptides and we have liposomes, which are the strength of the boosting, which we are going to boost the effect of the cocktails. So let's imagine up until now, in terms of waking up the skin, we've maybe prepared the skin, we've exfoliated it, we've woken it up, and we've prepared it to be able to start working with the different types of cocktails. If you had a much deeper wrinkle, and there was an imbalance of the lipid layer, and we've had reduced muscle tone, so that we can now boost all this with peptides, which are biometics. So this is a chain of amino acids which intervene in the communications and intercellular communications, which are key, which we have in our body. So the liposomes is a system of encapsulation to protect these peptides and link them to a specific area. So we're now going to talk about this advanced layer, advanced range, and then we will see the So the first one that we find is the NCPR. It's which offers nutrition to the skin, and it will improve the action of deep hydration and the elasticity of the skin. It contains hyaluronic acid, amino acids, coenzymes, minerals and vitamins. So the next one that we have is non-high reticulated hyaluronic acid with medium molecular weights, designed especially to obtain long-lasting results. So thanks to its particular size and the aqueous gel form, it has firming properties and hydrating properties in the long term, so providing a tensor effect which is immediate. So let's remind ourselves that this is a non-reticulated hyaluronic acid at 2%. So before we were talking about how to deal with the area around the eyes, we now have a rejuvenating complex, ECPR, which improves the appearance of eye bags and expression lines in the eye area. So due to the organic content, so organic silicum, artichoke extract, and extract of ginkgo biloba, vitamin C, sodium hyaluronate. So it's a bit like paralyzing all of this area around here, which is what we managed to do with this peptide. And now this area from here, we can work on the eye bags. We can stop this bag developing, and we can work on all of the area around here, which might be wrinkled, and work on the severity of the pore circulation and via our main ingredients that we find. So now we're going to look at how it is applied. So how we can work with a mesotherapy, which up to now we have managed to see. So the technology that we use, as I was mentioning before, in phase 2 is the pulse booster technology. So this technology is very innovative and works by combining cutaneous electrostimulation and microabrasion. So the result is the vehiculation of the main mesotherapy ingredients in a way which is precise and safe. So here we can find, when we talk before about electrostimulation, let's go back to the screens and look at what electroporation is. So electroporation is very familiar to all of us in this industry, and it's very well known. It's used in different treatments, in different institutes or medical centers, and it's also used to do tests in different types of products, and for a penetration of any kind of ingredient which might be needed to use. So it's used depending on its voltages and its frequencies in different tissues and its different depths. So at aesthetic level, we have different studies, and we're not walking, we're almost running. So when we have a new device or a new product or a new issue in the market, we try to improve it by linking our knowledge, so to have better penetration, to have a less light, a less heavy texture. So the same thing happens with devices. So what we find is that electroporation, which is typical, had a high voltage and a low frequency. So we're now going to see the difference between the apparatus, which is typical of electroporation that we're used to, that which works with high voltage and low frequency. Well, our device of pulse booster is electro stimulation, and it is different. So we have to have three clear concepts. The electrostimulation, cutaneous electrostimulation, used in our pulse booster technology, emits pulses in a square wave at low frequency and low voltage. So what does this mean? It means that when we work with a square wave, we have a pulse which is consistent and homogeneous to guarantee the uniform entry and to make the most of the ingredients in the dermis. And there's a guarantee of a uniform effect of the product. So we do this with a low frequency wave, which is able to penetrate deeper layers of the skin. So therefore we will have visible effects which are almost immediate. And we're going to work with a low voltage. So this promotes the rapid recuperation of the tissue and avoids any discomfort for the patient. So this guarantees that it's safe to use. So we use the part, as we saw before, of the cutaneous electrostimulation, and we're now going to talk about microabrasion. So thanks to the micro protuberations on the heads, which we'll now have a look at in the next slide, we have a superficial scraping of the horny layer to promote the penetration of ingredients. So when we are waking up our skin with a peeling, what we are doing, and what we are... So then we have 2 weeks between 21 days where we don't act with the peeling. So mesotherapy, we're going to do it every week. So we're going to make the most of these heads and the microabrasion, and to have a superficial scraping of the horny layer, which will scrape and exfoliate little by little, and this will ensure a uniform distribution of the product. So now let's have a look at the heads of the device that we were talking about before. So it has two parts. We have the cutaneous electrostimulation, which you have here in the lateral sides, and you also have the microabrasion, which you can see in this central plate, which you can see the little bumps on it. So we can see this on the head. So therefore, putting all this in summary and to be clear about what our pulse booster technology is, it's pain-free, effective and safe. It's a pulse which is low frequency, low voltage, to have a non-invasive and maximum effect. So this is not aggressive at all. So we have an optimization of ingredients. So we're going to make the most of the main ingredients to the maximum, and we're going to dosify it as we need to. Obviously, when I work on the neck, on the face, on the cheeks of the area, it's never going to be the same around the eye area or on the cleavage, for example. Around the eye area, you'd need much less product and much more care. So now let's have a look at the device so that you can evaluate it and have a look at it. It's a small device, so it weighs 2.5 kilos. It's very easy to manage. It's very easy to transport as well. So it's a pistol without needles. So it looks a little bit like a gun. It's easy to hold. It doesn't weigh too much. It's very adaptable. And then you'll see in a video and how it works later on so that you can see that a bit better. So it has a touch screen, and the design of the heads to it, which go in this part here, and it's an innovative design, and it's different to something that you've seen before. So now let's have a look and finish with the treatments which we were talking about before, we do in our consultation, which we are in the phase 2 of mesotherapy, and with our device, with our pulse booster technology, to be able to link all of the ingredients, the main ingredients we find in the cocktails. And we then finalize this with our masks, which, if we work with grade 1, as we can see here, we have anti-pollution, which contains alga chlorella, coal, white clay, and extract of white ginseng. So this is going to bring us the same as the anti-pollution cocktail. So this will eliminate toxins in the skin and brings oxygen to the tissue and uniform tone. So now if we go on to grade 2, we have a vitamin burst, which is sodium ascorbate, and this will combat the free radicals and balance the skin in terms of vitamins and essential minerals. So when we then move on to grade 3, we have anti-aging peel-off. So here we can see a main ingredient which up to now we hadn't seen before in any cocktails. So we're talking about the spirulina and alga laminaria. So this decreases facial wrinkles and stimulates the synthesis of collagen and of elastin. So this will have a tensor effect and plumping effect, and will make my skin and elastin last longer. So now let's have a look at the last phase, which is the phase 3, so our pharmaceutical cosmetic product. So as we mentioned before, we can't have a treatment if we don't deal with it from beginning to the end. So this is a topic which is complicated. It's complicated because the patient can always say, well, I've just bought a specific cream and I want to use that one. Well, sometimes there are treatments which, like always, they don't allow you to do this. You've seen in other treatments that, first of all, we deal with the problem of anti-aging, what is happening, and then we try to go through phase 1 and deal with the different layers and see how we can work with this and regulate and restore this loss that you have had. So this in phase 2, I continue this in the cabin, in the consultation, and then finish. I have the cocktails, and then we repeat the main active ingredients many times to continue to strengthen it. And I have to have the commitment from my patient, the person who wants results, and they have to follow up with the home care product that I'm going to recommend. Why is this? Because it's going to have the same active ingredient with the same form that we've worked on before, so that they can see the results and they can continue using it at home. And we can repeat every day this effect on the skin, the same principle, and by being consistent and working consistently. So what have we got in our... So we've been talking up until now, it's a wide selection of professional products which are formulated with active ingredients of pharmaceutical quality. So just like home care cosmetics, it has a high concentration of the same active ingredient to boost the effects of the treatment carried out by our professionals in the consultation room. So we're going to be working with a great product, which we may do a lot of work, but we require the commitment of the patient for 5 or 6 weeks, depending on the protocols, but they must have that commitment to continue working on this in their homes on a day-to-day basis with the same active ingredient. So all of our cosmetic products are dermatologically tested, and they are free from nanoparticles, phthalates, ingredients derived from humans, and parabens, like we mentioned before. So we're now going to have a look at the importance and why we want this and why we need our patient to continue with our same products and to deal with this from beginning to end of any treatment. So we're now going to look a bit about liposomes. So this is preserving the integrity of the encapsulated peptide. So this is a biomimetic composition, so the latest generation liposomes to protect the active ingredients, and we encapsulate them and allow them to be liberated in the target layer of the skin, so that they're up to 10 times more efficient than free actives that are not encapsulated. And this from the laboratory has been created like a flat disc shape. This is the liposome, and we can here see some little filaments, so some little balls around here. So that is what goes into the layer, into the adipose layer. Between the lipids, we can try to maintain this lipid layer of water and of fat, and the rest of this, that's what penetrates, and that's what's encapsulated in the main active ingredients until the target layer where we want to work with. So this is formed with molecules of water, and these filaments of here are made with lipids. So we're now going to have a look at the professional knowledge of an ampoule that are used at home. So these are all have liposomes in them from different lines, apart from this one here, which is the Vita Flash, which doesn't have liposomes in them. So therefore, these are ampoules where from one day to another, we have this ampoule open. 1 day or 2 days, for whatever reason, it's not going to have any problem just because it's has liposomes in. It's not going to be oxygenated. So here we can see how we can get to the right layer and how you get them active ingredients to the right layer. I've just the speaker is just asking for a battery for her computer. So sorry about that. That was a slight technical issue there. So we have here an ampoule, we have a serum, and we have a cream. So here we have the liberation of active ingredients in deep layers. We have an aqueous texture, which is much more pleasant to use on the skin. So when you deal with anti-aging, always with oily skin, if you have a patient who said, oh, I don't like oily texture, I can't put anything on my skin, it would irritate my skin, this is a good way of starting because it has a very aqueous and light texture to it. So it has a high concentration of liposome ingredients. We have here what is the serum format, which nourishes, repairs, and hydrates. It has a high concentration of ingredients, and it has a more aquagel texture, and it works in medium layers. And then here we have the cream, which has a high concentration of active ingredients. Obviously, its texture is light, but it's more creamy, and it works in medium layers and protects the superficial area as well. So here we can see if we have a liposome ampoule, or we can have a serum or a cream. In the morning, for example, we can use the serum and the cream at night. So that doesn't mean that this article is a substitute. It really doesn't. We can use both, but you wouldn't need to use them at the same time. For example, in the morning, you'd use you wouldn't need to use the ampoule, the serum, and the cream. You could just use two at the same time, depending on what you prefer. So now let's talk a little bit more about the ampoules that we have. And some of the ampoules that we have is the anti-aging and hyaluronic acid for aged and wrinkled skin. So here we have the indications. So wrinkles, flaccidity, switched off skin, dehydrated skin, mature skin, or aged skin. So here you have the main active ingredients here: hyaluronic acid, growth factors, which we've seen before, functional peptide, and probiotic. So all of this, the main hyaluronic acid and growth factor that we spoke about before. So an ampoule for dry and dehydrated skin, damaged skin, and switched off skin. When you have very dry and switched off skin, which is very damaged and very irritated, which might itch, we would very much recommend lipoproteoglycans. This is for dry, dehydrated, and switched off skin and damaged skin. And the components that we have here is proteoglycans and vitamins. So here we have the anti-aging lines of creams and serums that we find in the anti-aging range. And we also have this part here, Aqua Balance Cream and Aqua Balance Mesoserum. And we also have hyaluronic acid, organic silicon, vitamin C, all of these main active ingredients that we have in our cocktails. And this would be the skin creams that are recommended for lighter wrinkles. So if we look here as well, we go to grade 2, and here we have the repair serum and the repair cream. So we will now have the hyaluronic acid, collagen, elastin, and proteoglycans, and growth factor, collagen, tensor. And all of this is what we have been repeated from the same main ingredients. So with this, what I'm doing is making my patient or my client to continue with the same active ingredient for the entire treatment process. And here we also have the Skin Architect range, which is a new range which we've strengthened and we've worked on a lot in our laboratories. And here we find the hexapeptide 8, collagen, elastin, DMA, L-carnitine, organic acid, and retinol. So this is going to sustain this layer. It's going to tone my skin with retinol. It's going to refine my skin, and it's going to give me an effect of luminosity in my skin. In the periocular area, we work with anti-aging eye contour. So this is a cream which is for all types of skin and will work all around the eye areas. So it will diminish the signs of expression line and wrinkles, these fine wrinkles in expression lines, it will have the lack of firmness, the plumpness around my eye area. So within this line as well, we also have the Total Recovery Cream. So this is designed for damaged skin, dry skin, weak skin. So we can also use it with other type of treatment that we have as well. But if you need regeneration, if you need vitamins, we always have the Total Recovery Cream. So, and obviously we can't avoid speaking about sun protection, because it's very important for the end of any type of treatment. And this maintains the hydration of the skin, it stimulates the regeneration of the skin, and protects us from rays. So now we have the anti-pollution cocktail total defense cream. We've spoken about the cocktail, but this is a cream. Working on free radicals to improve the hydration, nutrition of the skin, so it protects from rays and from the blue light from digital devices. So nowadays we use a lot of mobile phones, tablets, etc. All of those emit blue light. So it comes with SPF 50, and it's dermatologically tested, and it improves the appearance of wrinkles and stains. So if we remember when we spoke about the main ingredients of the cocktail, it improved the toning and it gave luminosity to the skin. So we can finish it with in grade 1 as well of anti-aging, in a cream which is hydrating, and as we've seen before, which was the Aqua Balance, or even we can finish with the Total Defense Cream, depending on what we find. So we spoke also about the Peel Booster. So Peel Booster stimulates cellular renovation and prolongs and boosts the effects of peelings, and it activates the synthesis of collagen and elastin. We have the same layer and our firmness. It reduces the depth of wrinkles and stains, and the little stains and the marks that we might have, and it has a strong antioxidant effect. So it contains vitamin E, and it also contains retinol. So here we have the protocols that Toskani has formulated for anti-aging, grade 1, grade 2, and grade 3, and the anti-aging eye contour area. Here we have the just an idea of the protocol of the anti-aging 2, so the chemical peeling that we'll be using, and then the mesotherapy on the second week. Then we'll do another chemical peeling, then 4th week mesotherapy, and then the different chemical peelings that we're going to use. Grade 2 anti-aging, and which mesotherapy, and which cocktail, and which product from our advanced range we're going to use. So this you will find in all of the protocols, and we'll make sure you get a copy of those. So now let's have a look at an application protocol. Let's have a look at the process of applying all of this.
Aquí podemos observar toda la línea de productos de...
Okay, so here we can see the range of products in the anti-aging range. And here we have our patient. So we're going to start by cleansing this patient's skin very thoroughly. So we're going to use our own cleanser. And there's we use it in the same format is for home care as what we use in the consultation rooms. So we do it with morning and night. And this is just so you can see the way that you do it. And you should be doing this for around 4 months. So it contains ginger and cucumber and cinnamon. So we apply it to the face, and we work on their forehead, eye area, this area around the nose. It's ophthalmologically tested, so that's okay to use all over the face. Then we take it away with water. Now we're going to use bamboo tonic. So the bamboo tonic has bamboo extract and orange oil and lemon oil and aloe vera, so lactic acid and glycol. So we're waking up the skin to be able to use it, and it's very pleasantly scented. So we're just going to apply it and take it off. And now we're going to use the oil remover. So depending on the skin and the tissue that we have, we're going to work a little bit stronger or a little bit lighter. With sensitive skin, we will do this, but with less pressure. But if the skin is very oily, then we will press a bit harder. So now we're going to apply a protector around the eye area and where the wrinkles are, around the lip area as well. And we're going to also put it around the nostrils as well, which are very micropigmented areas. So we can also protect the eyebrow area as well. So now that we've used the protector, so we're now going to apply some cotton buds soaked in bamboo tonic around the eye areas. This is very pleasant. And now we can apply the peeling. So this person will not have any acid in their eye. So we will have 5 milliliters of acid, and we're going to apply it. So on the video, we can see it much slower than what we do in the treatment room, so that you can see how it's applied. And here on this clock that I have here, it says 7 minutes maximum, but I recommend always from the moment you apply it, only using it for around 2-3 minutes. So you have to go very lightly when you're doing an application, because otherwise, when you want to do the next one, you don't have the same exposure time. So let's go over the... we have to move around the patient's face in order to not accidentally hit them with the brush as you're going around. And so once you've applied all of this and the maximum amount of time, 2 to 5 minutes, have gone past, I recommend 2 to 3 minutes, or especially the first sessions. What we're going to do now is neutralize the product with our neutralizer. So now we can see a sensation of prickling or tingling. So this can happen by, it might feel like it's burning or very hot. So if you have any doubts, because the patient might be in doubt and can't tell the difference between burning or prickling, we neutralize it and then we apply, we remove it with water. So if it was tingling or itching, then we just use the neutralizer. But if it's really burning, then we have to use water as well. So now let's have a look at how we use the pulse booster cocktails with our pulse booster technology. So we extract the cocktail from the vial with a sterile needle, with a syringe and a needle. So now we put our device on with a touch screens, we program it, we load the syringe into the handpiece, and we'll use the touch screen to make the bottom bit come up a little bit and hold the syringe in place. Now we can start to work with it with movements from the center of the face outwards. So we always have to accompany the device and see how we accompany it. So we're doing half face lines, and we always want to try to follow it round. So you can see here that I'm moving it around a little bit from outwards in, just as though I'm giving it shape. So this part here, you can see that all of this part, we're working from the bottom upwards to be able to guarantee the toning of this area. So you can see as well that it's always going towards us. So otherwise, it is a bit forced. So you always move the device towards you. So you bring it around the eye area. You can see it that we can work all around the eye area because it's not invasive at all. So if we find bags or if there are crow's feet or wrinkles around this area, it can be used fine. So now on the forehead area and the eyebrow area, you can see that we don't use the eyelid, used on the eyelid, but just above the eyebrow you can. So on the forehead you use lateral movements, not applying any pressure and accompanying the device. So this is wrist action. You have to accompany it. So we're now doing traces on it in the opposite direction. So now you have the part of this area, which I'm now going towards myself in a vertical motion to tone the area. And we're injecting into the forehead the lateral areas that we may have found. And now we're working in all of the frontal area above, and then this is what helps with expression lines that we may have. So now we're going to apply a mask, the peel-off mask that we saw before. So it'll be mixed with 90 milliliters of water, and we're going to put it on to work for 15 minutes. And once we have applied it, and once 15 minutes have gone, we're going to extract it. And if there are any remaining parts, we will move these without any difficulty at all. So you can sometimes have some stains in the area, and we just remove those with cotton and bamboo tonic. So now we're going to cover the face with the cream to rejuvenate and regenerate the tissue. And in this case, we're going to use Total Defense Cream and the anti-pollution cream. So we're now applying it to the face, the neck, and the cleavage area. And we can see that the patient now has sun protection. So we're now going to look at this. We're going to show you some studies that we have carried out from our department of clinical trials. So these are, this has been done with apparatus which has really extensively studied the effects, and on patients between 35 and 47 years old. They came voluntarily. So as you can see here, we have a treatment of anti-aging 2. So according to the protocol that we have stipulated and marked out, so this has been done 3 nights per week with Reticil. So here we have a fold, which is quite pronounced here in the nasal area. And here you can see how it starts to disappear. And you can see how this fold that we saw before is almost completely disappeared. So, as we were mentioning before, the results that have been measured with this equipment in terms of firmness and hydration. So after 3 treatment sessions, the firmness of the skin increased by 9.8%, and after 5 by 21%. And then after the whole treatment, it was maintained at almost 50%, which it's not just a flash effect. It's very good because for 1 or 2 days, this is a maintenance. And when we are talking about the rehydration results, after 3 sessions, you had an increase of 22.6%. After 5, it was an increase of 31.9%. And then after 15 days, the hydration of the skin continued to maintain in the skin up to almost 30% above its initial value. So we're now going to show you as well the study on anti-aging 3. As you can see here before, you have the before and after shots. And we had a combination with the protocol Y zone. So you can see here that the patient, the adipose and the firmness, which you may need in this area around here, has been combined with a grade 3, and as was mentioned before, with Y zone. So we're now going to show you the the final part, the before and after of a anti-aging eye contour area. So after 15 days from the last session, and this was used every day with the anti-aging eye contour by night and day. So as you can see here, the reduction of the most pronounced wrinkle here that you may have here, and it looks a lot less pronounced here, it looks finer and much lighter. So the same thing all around this area here. You can start to see some little lines in this area here, but in the after picture, you can't see them anymore. And you can see how you've got an area which is more pigmented. And even though you have some pigmentation here, because we haven't got rid of it completely, it wasn't the end of the treatment, but you can see how there is a contour which is different as it's thicker, and you have more thickness in the skin. What we see is a bit more firmness and uniform change in the tissue and in the skin. So that's all I have to say. So thank you very much for your attention and for being here today in our training session, because it's always great to accompany you from Toskani to continue working and learning about everything that Toskani has to offer us. And thank you very much for your attention. And I hope that we will see each other very soon. And in the treatment that we have before, the Pilar treatment in our institutes, we're very successful at the moment. And I hope that you are successful too in your institutes, and I hope that you can have excellent results, and I'm sure that you're going to have these. So thank you very much, and have a great rest of your day.